The South African Medical Association recently released a report on violence against healthcare workers. According to the Medical Association, the report was conducted to raise public awareness of their plight. Just recently, yet another doctor was murdered in Gqeberha. Let's discuss this report further with the SAMA chairperson, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, very good morning to you. Thank you for your time. This was a study which focused on nurses, doctors and paramedics. We have on many occasions reported on cases of violence against healthcare workers. Of course, what's reported in the news is not always a fully comprehensive indication of the full extent of workplace violence in the healthcare sector. What were some of your findings?
Well, thank you so much, and good morning to you and your viewers, and thanks for having me in the program. Paul, like you alluded to earlier on, this is a serious problem for us, and as you've indicated, it is a problem that really affects mostly three categories of staff: nurses, doctors, and paramedics. And our findings were also that almost half of those cases that happen in the workplace are not reported. So there was so much underreporting, but also it is a worldwide occurrence. It's happening at a global level, but also we're worried about, its consequences in the country.
Yeah, especially, it's not a problem exclusive to just South Africa, both in developed and developing nations. We know that as we marked International Nurses Day on Friday, there was a lot of talk about nurses being met with violence on a day-to-day basis. What types of attacks are being seen as you put together this report?
It varies. There's verbal attacks, there's physical, there's shooting, there's stabbing, all sorts of things, that people can use as indicated in the report. So it really depends on, where this is happening. But there are so many other things that are being used, to target healthcare workers.
And who or what are the risk factors when it comes to category? Who are we talking about?
Well, we're talking about mostly females. We're talking about people, of various ages, but perhaps, of a younger age at times. And also, it depends on the workstation that you are in. For example, if you are working in an emergency unit, in a psychiatric ward, you are at a higher risk of being of facing violence, from the relatives, from the patients themselves, from companions, whoever is escorting that patient.
So as you looked at some of the findings, when it comes to the reasons behind these violent acts of aggression, what did you see in that space?
Come again, Paul?
When it comes to the reasons behind these violent acts and the aggression, what did you find?
Well, we found that there are many reasons. People may perceive poor management of their patients or their relatives. Sometimes it might be an administrative problem where you find that perhaps patient is complaining or relatives are complaining that the queues are so long, and they may attribute that to doctors or nurses being slow to attend to them. Yet, if you have dire shortages of such categories of staff, you would expect such problems. So it really depends on the situation at that time. But these are some of the reasons what we found.
When it comes to the recommendations, in terms of strategies and guidelines, what are you finding to be some of the ideas around curbing such levels of violence?
Well, it is important that we don't conduct safety and security. As you know, it is the responsibility of the employer, or in this case, in South Africa, whether in private or in public, it is the responsibility of government. But what we are saying is that it is not a government problem alone. There are other stakeholders that needs to come into play, but also we need to consider the fact that the implications of this to the public health and also health outcomes in general. But in the country, we've got some policies in place, but we doubt that those policies are really effective in terms of curbing this scourge. So we are hoping that, as we come together, we as healthcare professionals, in our different organizations, but also with government, working with government to say, how do we curb this? Because it has serious implications. People may leave the country because they are not satisfied in their jobs, they are not feeling safe, and they might migrate to other safer places or even change career. So that is a very serious problem for us.
Yeah. And how much strain do you believe the ongoing incidents of violence are taking against healthcare workers and placing on medical facilities? Well,
it has serious implications because on the individual healthcare worker, you might find that they are pushed to depression. They may be absent at work. They obviously they are not satisfied with their job, and they may even leave. So with the healthcare system, the problem is that you will find that there are shortages because of what I've said in terms of absenteeism, but also you'll find that people are leaving, to safer places. You might change provinces, they might change districts, they might even change the country because it's a serious problem. So that adds on the shortages that we are already experiencing, but also the burnout on those that are behind, in the country. It also, have as a serious problem with government trying to retain people in the system. Because if you do not have a conducive environment, an environment that is not safe for a doctor or nurse or paramedic to work, then you cannot expect that you will retain people in the state or even in the country, because this happens also in the private sector.
Mm-hmm. What was quite interesting as I went through this report was how the numbers rose during the COVID-19 pandemic. That period saw a high number of attacks on staff in the healthcare sector.
Yes, you'll recall that that was a very stressful situation because you'll recall that even though we have, a reasonable number of employees or healthcare workers, but at the time the system was overwhelmed and everyone wanted to get access to the resources, and those resources were limited, and people felt like, the government and the face of that government was healthcare workers. They were not doing enough to attend to their dying relatives. So it really put a lot of strain and pressure on the healthcare workers. And I believe even now it's still causing problems in terms of the psychology of those healthcare workers. Because up until now, we have not seen any attempt by government to really sit down with healthcare workers and say, during COVID-19, what happened to you? There's no debriefing that has happened so far.
Mm-hmm. And very lastly, before we let you go, do you think that security has a lot to do with some of the problems and the levels of violence that are experienced? Because in one incident that I recall, I know that a healthcare worker was attacked in Limpopo, and the MEC at the time was saying that there wasn't much security could do anyway in the instance where a frustrated patient is waiting in the queue and wanting to barge to the front because they've been waiting for a long time.
Well, I think, addressing a security issue it's multifactorial. One, you need to look at the numbers that you have, people, so that people don't complain about long queues. It can't be a problem of healthcare workers that people are complaining or the public is complaining that there are shortages. It is a systemic problem. But also, you will know that we don't have any working cameras in the institutions. We do not have the wires are torn apart. The security personnel that is in there is not enough, and they are not trained, to work in a hospital environment. there are no metal detectors in the gates. I mean, it can't be business as usual when healthcare workers are finding themselves at risk of being killed. So we expect that government put all those metal detectors so that they can pick up if somebody is coming in with a gun or with a knife or with whatever they're coming up with. But so far we don't have that in the institutions. It's just get in willy-nilly. So we are saying to government and all the stakeholders, let us protect healthcare workers, because if we don't protect these healthcare workers, we have a serious problem with our healthcare system. It may collapse.
Very well. Thank you so much. Thanks for weighing in on the discussion. Mvuyisi Mzukwa, South African Medical Association chairperson, speaking there about violence against healthcare workers in the country.